Let us see some of the common problems that will happen to the newborn child and then how to tackle it. The first and foremost worry most of the mothers have is as soon as a baby is born, the baby's head is swollen, mostly in a normal delivery. There are two types of swellings. One is called the caput, the other one is called the Cephalohematoma. The caput swelling is usually a generalized swelling, make the head sort of conical. This swelling will happen when the mother had been in labor for a long time after the membranes have ruptured and then she had been straining for a long time. This swelling will disappear in 2 days time. You don't have to do anything to alter the shape of the head. The other swelling is called the Cephalohematoma. This is actually a blood clot under the skin in the head. This is usually confined to one particular area. The caput will be a generalized swelling, you cannot define the borders. Whereas in a Cephalohematoma, you will be able to define the borders. And this takes a longer time to disappear. It might take even 2 months. This again will disappear spontaneously. You don't have to do anything to manipulate this. That's the most important thing. Then the color of the baby. The color of the baby, as soon as it is born, the hands and the legs will be a little bluish in color. Apart from that, there will be some blue patches also over the baby's skin surface. This again will disappear in 2 days time. You really don't have to worry or do anything about it. If it is winter season, you can keep the baby's legs and hands covered well. The other common complaints that mothers are worried is the sneezing for the baby. Sneezing will be there for about 3 months. Sneezing is nature's way of clearing the nose. When the baby feeds, sometimes the milk comes back and comes through the nose, it gets blocked. After delivery, the amniotic fluid and all will be there a little. The baby doesn't know how to blow its nose. So, God has created the sneezing so that it can clear its nose by itself. You don't have to put any buds or anything. It does not mean that the baby has caught a cold. If anything comes out, you wipe it. You don't have to put in any buds inside and then wipe it. The other common complaint again is the hiccup. Hiccup is again because the stomach is enlarging and the pressing on the diaphragm. Again, just observe the baby, see to it, it doesn't regurgitate or aspirate. Otherwise, don't give water during that hiccup. Okay. So, you just have to observe. If it brings out anything, just turn to the sides and then let the fluid go out. And then many people keep complaining that the baby keeps vomiting. See, it is not vomit. See, the distance between the mouth and the stomach is less than 4 to 5 centimeters in a baby. The moment it presses the abdomen, say due to folding of the legs or we press or something, the milk can easily come out. That is nothing to worry if it is limited. To prevent that, what you should do, after feeding the baby, put the baby on the shoulders, pat the back of the baby nicely, it will bring out the air and then the bringing out milk from the mouth and nose after feeding will be less. In spite of that, if there is a little, you don't have to worry. Just monitor the baby's weight and other parameters. If the baby is alert, grows well, you really don't have to worry. Sometimes the breathing of the baby will be like a little intermittent. Suddenly it will say then it will stop breathing for a few seconds, then it will breathe. This again is normal. But if the baby is finding it difficult to feed, the breathing is more, there is distress, or if the intercostal bones, the rib bones, intercostal areas, the rib bones become prominent while they feed, if they have difficulty in taking the milk continuously for few minutes also, then you should consult your doctor. Then many babies will develop jaundice from the third day of birth. The baby's hemoglobin inside the mother is around 18 grams. This is fetal hemoglobin. When it comes out, it has to come out like the human beings which are living outside the mother's womb. So, that has to come down to 14 or 15 grams. For this, the rest of the blood has to be broken down. So, when the excess blood is broken down, that produces these bile pigments or the jaundice pigments. The eyes, nose, skin, everything will be yellow in color. From the third day it starts, it peaks around the 5th, 6th day, and then after that again it gradually declines. By around 14th, 15th day, most of the time the jaundice will disappear. The doctor will monitor if it is only the face and the eyes that are yellowish in color, that can be just treated at home. There is no need for any other treatment. But if the whole body looks yellowish, the abdomen, legs, everything looks yellowish, then the baby's jaundice level has to be measured, and then depending upon the level, the baby will be given what is called as phototherapy. This is nothing but light therapy. The baby is placed in its bare body under an ultraviolet light. This will be given for 2 or 3 days. Again the jaundice level will be monitored. If it has a decreasing tendency, the baby will be sent home. But if it is increasing, especially in cases where there is an incompatibility of the blood between the mother and the baby may need a blood transfusion, what is called as an exchange transfusion. The baby's blood will be taken out and a fresh O negative blood will be given to the baby. This is only in very rare situations. If the jaundice levels goes beyond 20 milligrams of bilirubin, then it is dangerous for the baby's brain. So, only in those situations this sort of things will be done. Most of the times it subsides with the phototherapy that is given. So, especially watch for it around the 5th, 6th day. If you are doubtful, take the baby to your doctor, show her or him, and then decide whether the baby needs phototherapy. This is not an infective type of jaundice. Okay, this is not because of any viral or a bacterial infection. This is a thing which happens naturally. It's called physiological jaundice. This you don't have to worry. But if the baby develops jaundice on the first or second day itself, then maybe it will need a little extra measures to clear the jaundice, and more investigations may be needed. A reflex called morosum, as soon as any sound or anything, the baby will do like this. That is a normal phenomenon, you don't have to worry. And then crying before urination and passing motion again is normal. It will be just for a few minutes, you don't have to worry. And when it comes to passing motion, some babies pass motion once in 5 to 6 days. They will not have any difficulty, they will feed well, they will be sleeping happily, but will pass only in 5 to 6 days time. The motion consistency also will be normal. Some babies pass motion each time they take a feed. If they take feed 5 to 6 times a day, they will pass motion 5 to 6 times a day. This motion will be a little watery and with flakes of yellow motion material. And supposing you lift up the baby's buttocks, it might go for a meter also. That motion will be going that speed. So, you really don't have to worry about this. Then when do you know it is abnormal? If the baby doesn't pass motion and if it keeps crying, if it vomits, not taking feeds well, then something is wrong. The baby has to be shown to the doctor. If it passes too frequently, If there is a little redness around the anus, a little redness is okay, but if the redness is very severe and if that anus area is ulcerated, then it means there is a milk allergy. So again, the baby may have to be placed on another milk for a few days till that lesion heals. This sort of milk allergy can happen to breast milk or any other milk. It does not mean that anything is wrong with the mother's milk and that she has to stop feeding once for all. It is not true. The mother's milk is absolutely fine. It is just that the baby is developing some allergy and it will regain its normal motion, everything after a few days. So after 3 to 4 days, the mother can start feeding again on the breast milk. 5 to 7 days. Sometimes it takes even 10 days. After it falls, for 1 or 2 days, the umbilicus will look a little moist. Okay. You really don't have to do anything, but if you want, you can put some antiseptic powder recommended by the doctor. You have to keep that clean. Don't put anything else except that antiseptic powder. And sometimes when the baby cries or passes motion, there may be a little spot of bleeding from that umbilicus. That again is nothing to worry, that will disappear in another 5 to 7 days. It falls off around 5 days and then it might take another extra 5 to 10 days to heal completely. For few babies, the umbilicus may look a little big. It will pout out when the baby cries or when the baby strains for motion. This again most of the times will disappear when the baby starts crawling. Okay, this again nothing to worry. Some babies develop engorgement of the breast. After the 3rd or 4th day, if you see the baby's breast, it will look like a little bigger. Many people try to take out milk from that and then try to squeeze and do all that. Please don't do any such thing. That is because of the mother's hormones effect. That will again subside in another 2 or 3 months time. You don't have to do anything for that unnecessarily. In case of girl babies, there may be a white discharge from the vagina on the 3rd, 4th day and there may be a little bleeding from the 6th, 7th day from the vagina. It is again because of the mother's estrogen hormones effects. This will disappear by itself in 5 to 7 days time. You don't have to do anything for that. Just know that these things are normal. There is another condition called infant colic. One particular time of the day, it may be evening or night or day, one particular time of the day, most of the babies start crying at that time. They keep on crying for half an hour to 1 hour, sometimes even for 2 hours. They may refuse feeds, they may take feeds and then vomit, they may keep crying for nothing, nothing can be done to console them. If you sing, dance also, they may not stop crying. But after some time, automatically they might vomit a little and then settle down. This is called infant's colic. This happens to many babies. It may happen up to 6 to 9 months also. One particular time of the day, they will start crying. This again, if it happens automatically every day, then you know that is the infant's colic. We really do not know the exact reason, but this does happen and that is again nothing to worry. When you should go to the hospital, that you should remember. When the baby is not taking feeds well, when the baby is not gaining weight, keeps on crying all the day unnecessarily, then the baby should be taken to the hospital. If the baby takes feeds well, sleeps well, gaining weight, then you don't have to worry about anything else. Dear mothers, I hope this video presentation helped you to get over your fears and hope this enables you to take better care of your children. Taking care of a baby is a pleasure and a pain too. Sometimes you are happy, sometimes you are irritated, sometimes you feel guilty. All these emotions are part of bringing up a baby. Don't get worried. Try to give the best to the baby. You will give the best. Your intentions are good, and if you give your love and affection without any condition, you are doing the best to your baby. The most important thing in this is to get the maximum help from your family, from your husband, from your in-laws, from your parents. For the first few months after delivery, do not worry about anything else except about your health and your baby's health. Forget about the family disputes, forget about all problems, work pressure, nothing. The world should be only you and your baby. Just take care of yourself. You will be able to pull through these months, difficult months, very happily. Wish you all a happy motherhood.